Do you know the ultimate oral care routine? If not, then you're in for a treat. Oral care is more than just maintaining a sparkling smile. It's about preserving your overall health. Poor oral hygiene can lead to serious health problems, from gum disease to heart disease. That's why it's crucial to establish a comprehensive oral care routine. Our routine focuses on 3 main components: brushing, flossing, and tongue cleaning. It's not just about doing these things, it's about doing them right, and that's exactly what we're going to show you. Brushing is the cornerstone. Doing it properly and regularly can prevent cavities and gum disease, but brushing alone isn't enough. Enter flossing, the unsung hero of oral care. It reaches those hidden spots where your toothbrush can't. Lastly, we have tongue cleaning, an often overlooked but vital part of the routine. So, let's dive into the first step of our ultimate oral care routine: brushing. Brushing your teeth is something you've probably been doing since childhood, but are you doing it right? Now that's a question that begs a little introspection. Let's dive into the art of brushing and see how we can level up your game. First things first, your tools. Choose a toothbrush with soft bristles. Why soft? Well, hard bristles might seem like they do a better job at scrubbing away plaque, but they can also be quite harsh on your gums and tooth enamel. Soft bristles, on the other hand, can clean effectively without causing unnecessary damage. Next, the toothpaste. Fluoride is your best friend here. It's a natural mineral that fights tooth decay by strengthening the tooth enamel. So look for a toothpaste that has fluoride as one of its main ingredients. Now, onto the technique. Brushing isn't just about scrubbing your teeth back and forth. Instead, think of it as a gentle massage for your teeth and gums. Use small circular motions, making sure you cover all surfaces. The outer, the inner, and yes, the chewing surfaces too. Timing is key. Brush for 2 full minutes. You might think it's a long time, but trust me, it's just enough to give each tooth the attention it deserves. And while we're on the subject of time, let's talk frequency. Brush at least twice a day, once in the morning to kickstart your day with a fresh breath, and once before bed to clean off the day's accumulation. But wait, there's more. Don't rush to rinse your mouth right after brushing. Let the fluoride in your toothpaste have some more time to do its job. And when you do rinse, just use a small amount of water. You don't want to wash away all the fluoride, do you? So there you have it. The proper way to brush. Remember, brushing is just the first step. Next up, we've got flossing. Stick around to learn how to become a flossing pro and take your oral care routine to the next level. Flossing might seem like a chore, but it's an essential part of your oral care routine. And here's why. Flossing effectively removes plaque and food particles that your toothbrush can't reach, specifically the spaces between your teeth and below the gum line. This is crucial in preventing tooth decay and gum diseases. So, how do we floss correctly? First, let's talk about how much floss you should use. A good rule of thumb is about 18 inches. This might sound like a lot, but it allows you to use a fresh segment of floss for each tooth, which is important for hygiene and effectiveness. To start, wind most of the floss around your middle fingers, leaving about 2 inches of floss to work with. Hold the floss taut between your thumbs and index fingers. Now gently glide the floss between your teeth, but avoid snapping it into the gums, which could cause injury. Once the floss reaches your gum line, curve it into a C shape against one tooth. This is a crucial technique often overlooked. The C shape allows the floss to enter the space beneath the gum line, effectively removing plaque and food particles. Slide the floss gently up and down, rubbing it against both sides of each tooth. Remember to use a fresh section of floss as you move from tooth to tooth to avoid spreading bacteria around your mouth. And how often should you floss? Ideally, flossing should be a daily ritual. While it might be tempting to skip a day, remember that plaque builds up every day, and once it hardens into tartar, only a dental professional can remove it. So there you have it, the fundamentals of flossing. It only takes a few minutes of your day, but can have a profound impact on your oral health. Flossing takes care of the spaces your toothbrush can't reach. But there's one more area we need to clean: the tongue. Cleaning your tongue might not be part of your routine yet, but it should be. This often overlooked part of oral hygiene is essential in maintaining a fresh, healthy mouth. Let's dive into the how. Start by securing a tongue scraper or your toothbrush. With either tool, you'll want to gently but firmly clean your tongue from back to front. It's important to start from the back, because that's where most of the bacteria that cause bad breath are hiding. Cleaning your tongue isn't just about freshening your breath, though that's certainly a perk. It's about removing bacteria and potential toxins that might otherwise proliferate. By cleaning your tongue daily, you're reducing the risk of these bacteria contributing to other oral issues like cavities and gum disease. Remember, tongue cleaning is not a substitute for brushing and flossing, but a complement to these practices. Now that your tongue is clean, let's wrap up our ultimate oral care routine. So there you have it, the ultimate oral care routine. We've covered the 3 vital components of maintaining your oral health. Starting with brushing, remember to do this twice a day for 2 minutes each time using a soft bristled toothbrush and fluoride toothpaste. Brush gently and in circular motions to reach all the surfaces of your teeth. We then moved on to flossing. The importance of this step cannot be overstated as it removes plaque and food particles from those hard-to-reach spaces between your teeth. About 18 inches of dental floss should suffice for this task. And finally, we discussed tongue cleaning. This often overlooked step is crucial in removing bacteria and keeping your breath fresh. You can use a tongue scraper or your toothbrush for this. Consistency is key with all these steps, so make them a part of your daily routine. Remember, a healthy mouth is a key part of a healthy body, so make this ultimate oral care routine a part of your daily life, and your smile will thank you.